I'm asking you if you put 1,000 cc on your patient.
They don't make it.
Would you do that now for me?
They will not custom make you an over 800. Let me say it again. They don't make 1,000 cc silicone implants.
I love watching plastic surgery on TV. And it's not just because I'm a board-certified plastic surgeon, although I think that probably has something to do with it. Well, the #1 show regarding plastic surgery on TV today is Botched. And so we're going to watch an episode of it today, and I'll give you my honest reaction as a plastic surgeon. My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. So today we're going to watch an episode of Botched, and this one is going to cover a person who is what we would consider a plastic surgery enthusiast. So I will give you my honest reactions. Let's watch.
Hi bitches, it's Frenchie. You might remember me from Rock of Love, I Love Money, and Charm Store. I act, I sing, I model. I'm 40. I can't even think about getting old. That will give me anxieties, panic attacks. I make sure I go to my surgeon every 3 months so, you know, he can remove all those wrinkles. But right now, my breast is not that plastic fantastic. When I was 27-year-old, I had my boobs done in Miami. I paid $3,000. I had 350 cc's saline. The second boob job, I did it in Beverly Hills, California, 650 cc, and I'm now a 34D. The scarring is still here, it's still bad. The second thing, they are too small, I would like them bigger. And the third thing, I actually have a really big separation between my boobs, you can put the whole hand between. Then after that, I think I will be set. When I walk in a room, everybody notices my personality first and then my breast. It should be the other way around. You want to spend daddy with me?
It's interesting. A lot of people think because I'm a plastic surgeon that I'm a plastic surgery enthusiast or my wife is one, and we actually aren't. I mean, there are people, you know, who come to see me and, you know, they have one treatment done, they get so excited because they love the results, and then they have another treatment done, and then they want to have 5 more after that. And the problem is that the more that you do, the more you start looking different. And definitely plastic surgery is something where a little bit can be a good thing, a moderate amount can still be a good thing, but a lot of it is usually a bad thing. And we get people who get so excited about getting work done, and it just absolutely changes their life to the point where they are not anything like they used to be. And sometimes that's not necessarily a good thing.
Our next patient is Frenchie, who's had a lot of different plastic surgery procedures. I don't know exactly what her complaints are, but let me show you what her pictures look like. So this is before plastic surgery. This is her now. So clearly pretty, but she's a plastic surgery
She's got a big
enthusiast, right? Oh.
Oh.
Whoa, whoa.
She needs to be downsized.
Maybe. Frenchie has had every surgical procedure that you could possibly have. Her lip, her nose, her breasts. What more could she possibly want?
Hi bitches.
Frenchie!
I'm Frenchie. Je m'appelle Frenchie. Bonjour.
Hi, Frenchie. How are you?
Nice to
Terry
meet
Brooks.
you.
Nice.
So I've never had a patient ever walk in the room and called me a bitch. And looks like what she's doing is she's walking in, hugging her surgeons. I'm not a really huggy person, and yeah, this is a bit interesting.
I don't like to have clothes on, I'm French. My favorite outfit is naked.
Your what?
So-
Your favorite outfit is naked?
Yes, my favorite outfit is naked. I never understood why we have to wear clothes. I look better naked.
I'm the opposite. She said her favorite outfit is naked. I'm the type of guy that when I'm at the gym and going to the showers, I cover myself up and run through because I don't like being naked in front of people. I'm the opposite of Frenchie, apparently.
How much do you think you've spent total on cosmetic surgery up to this point?
Altogether, $50,000.
Wow.
And the only thing I'm missing right now is my boobs bigger. I would like to do 1,000 cc so I can have an F for Frenchie.
1,000 cc's.
Bigger is better.
Frenchie obviously likes everything big.
So she is asking for 1,000 cc's. If you want to go typically bigger than 800, you've got 3 options that you can choose from. And none of these I recommend. Now, they only make breast implants in 800, up to 800 cc's. Silicone goes up to that, and you can overfill that to whatever the heck you want. But essentially what you're taking is an implant that is shaped like more of a discus type of a shape, something that makes your breasts look fairly natural. And as you fill it, it becomes more and more of a sphere to the point where it can literally become like a beach ball filled with water. So that's one way to get to 1,000 cc's. Second way to get to 1,000 cc's is you can stack breast implants. This is not something that I recommend. I've actually never done it in the past, and I will never do it. But what that means is you can put not one implant into each breast, but two. And so to get to 1,000 cc's, you can put, let's say, two 500 cc implants in, you can put a 600 and a 400, and literally have two implants in each breast. As crazy as that may sound, that does happen. The third way to get to that type of size is one that is absolutely way, way out there, and it's not approved in the United States. They're called string implants. So if you have ever seen photos of women with impossibly large breasts, breasts that are like this type of big, it's quite possible that they have string implants. String implants basically are these strings that you put into the breast, and what they do is they actually will absorb water and they will increase in size. The problem with string implants, to my understanding, and once again, I've never seen them, I've never put them in, is that you can't stop them from growing. They just keep getting bigger and bigger and bigger and bigger and bigger to the point where I guess it's possible that it may pop at some point. These are not approved for use in the United States. So in general, 800 cc's, that's the biggest size that we recommend going. I don't recommend you go any bigger, but that's what she wants. Let's see what they say.
So I had the boobs done, 650 cc's, saline, under the muscle, and I was not very happy because when I woke up, they were really hard.
Yeah.
And they were very separated. And also, I still have some scar, and I don't think I should have scar after 10 years. And then it starts rippling.
Right, rippling.
Right, certain position, not now because I have my brow, but I can show you when I'm naked. But the thing will bother me is...
So she's complaining about rippling of the breasts and about scarring. So she must have had a lift, or she had some type of incision obviously placed on her breast to put the implant in. Scars are permanent. There's no way to get rid of scars. So if you have a scar from surgery or even from an injury, you're going to have that scar for the rest of your life. Now she has saline implants. They're under the muscle. Under the muscle is usually the way that I recommend doing it because it has a lower risk of complications. Saline implants, the good thing about saline is that it's just salt water. If it breaks, you know it's broken because the implant will deflate. And so you know if it's broken, you know if it's not. The negative about saline, though, is that they don't look or feel quite as natural as silicone. And what you can get is you can get wrinkling and rippling on the sides of the breasts, on the sides of the implants, that you don't get quite as much with the silicone. And so switching to silicone from the saline can potentially improve that. So now they're going to bring her Frenchie into the exam room and take a peek at her. Now, without having seen her exam or seeing what they're going to do, I'll be interested to see what they have to say. But just offhand, before we go in the exam room, I know myself, in my mind, I would probably be having doubts of maybe this is not a patient to operate on.
You were talking about, first of all, the scarring, right?
Yes.
Okay, I will tell you, this is really almost invisible. It doesn't get any better, this. Let me see what it looks like when you lay back. Okay, so you're talking about the separation between them, okay?
Well, when I lie down, it's really
Yeah,
hard.
so, all right, here's the problem.
Look.
Yeah.
Why I
so,
can put my whole hand there. That's
right,
nice.
so you want it more like that?
Right, totally.
You know what it is? If we sew up the pockets outside here to push them forward, look what it does to your nipples. Look, it puts your nipples this way as you put the mounds
No,
that way.
I love my nipple. It's the best part because
Right.
it's so natural.
So that is a displacement test that Dr. Dubrow just did. What I do is in the office, I push them towards the middle, and then I have the patient stand up and take a look at where the nipples go. Because you may find that when the implants are a little bit out to the side that the nipples point straight, but when you actually move the implants inward, the nipples start pointing outward. And so that's a reason not to do that operation. The other thing is that she does have a gap between her breast implants. They're under the muscle. The space between the breast implants is not caused necessarily by the doctor or the surgeon that did the surgery. They're caused by a person's own anatomy. And if you're under the muscle basically attaches to your breastbone. In some people, that muscle attaches off to the side. That causes the breast to be more separated. In other people, the muscle attaches towards the middle, and that causes the breast to be more towards the center. And you can't really change that. You know, the only way to change that would be to go above the muscle. But in this situation where you've got saline implants, they're 650 cc's, it's not something that I would recommend for her.
You know what my first impression is, honestly, of your breasts? These are actually very pretty.
They're too small. I want them really big.
No, leave them. Oh my God,
I
they're
want
perfect now. Leave them
1,000 cc.
alone.
That's the only thing left I need
Leave
to do,
them
and then I
alone.
won't do anything.
They don't make silicone 1,000 cc.
Why not?
They don't. They only make them 800.
Do you guys ever put 1,000 cc on patients?
They don't make them.
I'm asking you if you put 1,000 cc on your patients.
They don't make it.
Would you do that now for me?
They will not custom make you an over 800. Let me say it again. They don't make 1,000 cc silicone implants.
I'm just really heartbroken because I want them bigger, and that's really something else that maybe you guys can fix for me.
No. My recommendation for Frenchie is that her breasts look good the way they are, leave well enough alone. This is where patients end up botched. They take this, which is good, and they try to take it to the next level.
I guess there is nothing I can do right now. I don't definitely trust the doctor. I know they are the best out there, and I know they have my best interest.
So I really want to say Dr. Dubrow, he's completely on target in this situation. It's so common that you get a patient who looks great, and she looks at herself as being a 7 out of 10. And she just wants to get a little bit bigger, but to get a little bit bigger, you run the risk of complications. And I tell my patients this all the time. You know, I'll say, hey, look, you've got a really good result, and could you conceivably get a little bit better? Yes. But if we reoperate on you, we open up Pandora's box of potential complications. So for example, if he went back in and said, hey, you know what, let's go ahead, let's try to move the implants over just a little bit. What are some of the things that can happen? Well, you can get a uniboob. You can get a capsular contracture. You can get scar tissue develop around the implant. As you are moving things over, you can get nerve damage from the sides where if you're putting sutures out there. So there's so many things that can go wrong when you're trying to create even such a small change. So I do think in this situation, I really want to commend Dr. Dubrow. I think he used very good clinical judgment to say no to her. Unfortunately, there are lots of doctors out there that would see, oh, here's a very attractive woman who's kind of famous. She's been on reality TV shows. What a great patient to have. And hey, maybe I'll even, you know, if I operate on her, we can do it for local TV or for online or something like that. And so then doctors fall into this trap of operating on them, and then unfortunately complications can occur. So kudos to Dr. Dubrow. I turn down about 1 out of every 5 patients that comes to see me because some of them are just like Frenchie. So if you're interested in learning about plastic surgery, I think the show Botched is actually a really good place to go because not only do they fix people who have had problems, but they also are good at turning down people who really aren't good candidates for plastic surgery. So I really enjoyed this episode. I hope you did too. If you're interested in learning about what some celebrities have had done, check out this video right up here.